You like my 12,
Oh, yeah, that's cool.
12 stone background?
Yeah. Okay,
Is it the right
so
way? It's not backwards, is it?
what's that?
It's not mirrored, is it? It shows up the right way, right?
Yeah, that's the right way. All right, so maybe you just want to start by talking about what 12 Stone Health Partners is and what do you guys mainly work on?
Yeah, so my name's Cannon Lauer, the Chief Operating Officer at 12 Stone Health Partners. And 12 Stone Health Partners is a specialty pharmacy that focuses on patients with chronic, complex, and rare diseases. And we have multiple business divisions. We do retail med packaging. We package meds for long-term care facilities. We do home infusion. We have a specialty pharmacy that's licensed in all 50 states and dual accredited with ACHC and URAC. And then we have a Enrolls division for nutrition therapy. And we also have a medical practice that runs infusion centers in 4 states, Virginia, Kentucky, Tennessee, and Georgia, where patients come in to be infused. So we work with specialists like neurologists, dermatologists, GI docs, endocrinologists, those types that are treating patients for chronic conditions like MS or Crohn's disease. And we work with those specialists to determine what the proper therapy is that they need. Generally, those are infused drugs where you take them intravenously instead of by mouth. And in some cases, they need to be done under medical supervision in our infusion centers. Sometimes they can be done at home, and we ship the med and the pump to the patient's home, and we train them on how to use it. And sometimes we ship it into the physician practice, the specialist, and then they provide the meds to the patient there in their office. So that's what 12 Stone Health Partners does.
Cool. So what are some struggles that the pharmacy field is facing, particularly ones that you guys are focusing on? Where have you guys succeeded and where have you fallen short?
Yeah. I think definitely on the home infusion side, one of the biggest challenges is getting the med there in time for when the patient needs to take it. So typically with one of our home infusion patients, they're being discharged from a hospital either on an IVIG or antibiotic or pain med. And of course, when they're in the hospital, they're getting those meds there in the hospital. But when they get home, after they're discharged, you have to get that med there in a timely manner because you definitely don't want to miss your pain meds if you're sick and have just been discharged from the hospital. So it's generally a challenge for us because those discharge orders come to us, say at 11 a.m. We have to process those orders. We have to mix them in our clean rooms in one of our pharmacy locations. We have to box it up. Definitely a lot of drugs have to be stored in a cool environment. So we have to do a cold chain pack that makes sure that they can stay at the proper temperature for at least 48 hours in case it got delayed in shipment. And then we have to ship that, and we either ship it via FedEx, UPS, we have in-house drivers, and then we have third-party couriers, and we have to determine what the proper way to send that med is, what's the most efficient to get it there in time for when the patient needs to take it, but also what's the cheapest option for us. And we wrote some logistics software that tracks where the driver is and provides a geostamp when they deliver the med. And it also helps optimize a route because we try to have drivers deliver multiple meds to multiple patients. And it helps determine what the most efficient routing and what the most efficient grouping is for those deliveries. We do about 4,500 to 5,000 deliveries a month, and there's a lot of expense associated with that too. So being able to deliver it timely is important, but also being able to deliver it as cheaply as possible.
All right. So what are
But
some
I think here's one other thing is I'll tell you is a challenge of communicating with the patient. And when you're working with patients on therapy, it's very important to ensure that they're taking the meds and when on the cycles that they need to, and that you're setting up new appointments with their primary care physician to ensure that the drug is working the way that we intend it to. The pharmacists need to check with them to make sure they're not having any adverse allergic reactions. And something that has been very challenging is getting patients to answer the phone. I think most people don't have home phone now. They have cell phones and they don't want to answer those phones. So we're trying new technology. We've actually just upgraded to a new phone system that gives our staff the ability to not only call but text, because we feel like in this modern society we live in, people are much more willing to respond to a text than they are a phone call. We've also been testing with some patient-facing apps that we give patients the ability to load a 12-stone app on their phone and see the real-time status of where their delivery is, where the driver is, when they'll be there, get some text reminders of when it leaves our building and when it's been delivered, but also giving our staff another mechanism by which to interact with the patient and have them better engaged in their therapy.
So talking about AI, is there any areas where you see in the pharmacy field, in infusions particularly, where you see an opportunity where there's a large data set and you could use machine learning to optimize something? Is there any areas where you think that AI could be implemented, or there's certain parts of pharmacy where people are struggling to make advances?
Yeah, so two ideas I've got around the AI platforms. I just returned from Las Vegas where we were having the Assembia Specialty Summit, where about 8,000 specialty pharmacists from across the United States get together and talk about new drugs and new technology. Like I was talking about with patient engagement, it's pretty important when patients are discharged from a hospital or they have a chronic condition that they take their meds properly, that they're getting infused on. A lot of these drugs need to be infused every week. But on top of that, they have to be compliant with their pre-medication. So a lot of times there's drugs they need to take prior to getting an infusion, or they've got a certain care regimen that they need to stay on. So a lot of companies have been using just health coaches to call the patient and remind them, and it's a very labor-intensive task. So there's starting to be more automated AI-backed bots that are replacing humans, to where they've got voices now that sound very similar to humans, and they can call patients, they can ask questions. Those questions can be adapted based on the responses, based on their data set of what's been successful, what's not been successful, and then it can flag any patients that they think may not be taking their meds or may not be compliant, and could escalate that then to a provider or care professional that could call them directly. So that was one area where they talked about using AI. I know outcomes are very important to the payers, the insurance companies that are paying for these drugs, and I think they utilize some large data sets across all of their insured lives to see what's having better outcomes, because of course if they can reduce the impact a chronic condition has on one of their insured lives, it reduces their overall expense and prevents that patient from having to go into the hospital, which of course is one of the most expensive sites of care. So I think they utilize their data sets to determine, what drug and what frequency is having the best outcomes, so that they can replicate that with other patients that have similar chronic conditions.
Okay. Let's see.
One other thing that we utilize that's pretty cool is I talked about us doing med packaging. So we don't do bottles. We package our meds into individual packets for like morning, noon, and night. So if there's a patient that's taking multiple meds, they don't have to fill out a pill box. We actually sort the meds for them, and then you just tear off the packet for that morning or that night. Once those meds get packed and sealed inside these plastic packets, they come in a strip. So to ensure that we have the proper medications for the proper patient, each one of those packets has a barcode on it. We take that strip, the 30-day MedRoll strip that we created for that patient, and we run it through a machine which we call our Inspect RX, and it scans those packets for size, color, shape, quantity. It does a visual and infrared scan. It knows exactly what med's supposed to be in each one of those pouches. It knows the size and the shape, the color, the lettering that's on the pill. And it will actually do a visual and infrared scan of each packet, and will flag any packet that doesn't have the right meds in it, or the right number, or the right color. So that's pretty neat.
Is that machine using AI to recognize that, or how does that work?
Yeah, I mean, I'm sure there's some type of logic that it's got in there to determine whether this matches what it thinks it's supposed to be, because it's kind of complex to where, the meds can be all shuffled around inside the packet. So there's got to be some fairly advanced algorithms in the back that are making decisions on, does this match closely enough to say that we got the right meds in there.
I'm sure. Let's see. So what are some areas you think 12 Stone is trying to expand to right now?
We're currently building 14 new centers in Virginia, Kentucky, Tennessee, and Georgia. And one thing we've looked at using AI for is inside of those infusion centers, we have 5 to 10 private suites where patients come in and get infused. And those infusions can last anywhere from 30 minutes to, 8 hours. And the med costs can range anywhere from $10,000 to $300,000 a dose. So they're very expensive meds, very time sensitive, and some of them are short time, some of them are a long time. So it makes scheduling patients in those private rooms a difficult challenge to try to figure out. It's kind of like Tetris, trying to figure out how do you maximize the number of patients you get in a center per day, because that maximizes your profit. So we've not started this yet, but we have some fairly advanced tools that are being used by our data analytics group to go in and analyze how many chairs do you have in the center, what's the typical mix of meds that we have, and what's the most efficient way to schedule those patients in the chair.
Mm-hmm. Yeah, it's a good way. Okay. Well, I think that's all I got.
Okay. Well, good. Thanks for interviewing me.
Of course. Thank you for